Hi, welcome back to What's Up Doc. Today we're going to ask, am I drinking too much? The reason I want to talk about alcohol today is that there is definitely an underestimation that we have about how much we drink and also the consequences of the amounts that we drink. Alcohol is very much a socially accepted drug, and I want to talk about why that's the case. And I also want to talk about whether we should be restricting ourselves, how we find a balance, and what does the evidence say in terms of how healthy or not alcohol is for us. So, what are the main risks of alcohol consumption? Well, when we ingest alcohol, when we drink a pint of beer or wine, whatever, the alcohol goes down into our stomach and then gets around into our bloodstream. It's absorbed and it ends up in the liver. And in the liver, there's a biochemical process called dehydrogenation, which literally means that hydrogen is split off and taken away from the alcohol. As a result of this, you have two products. One is NADH and one is hydrogen, or the hydrogen ion, I should say. And the result of this is that the body produces what are called reactive oxygen species, and these are chemicals which... So, what are the main risks of alcohol consumption? First of all, when you have a glass of wine or a pint of beer, the alcohol gets ingested, goes into our stomach, goes into our bloodstream, and ends up quite quickly in our liver. And in the liver, there's a process whereby the alcohol gets converted into an intermediate product that's called acetaldehyde, which is actually quite toxic. And eventually it's converted into acetate, and acetate is a chemical which is the byproduct which is released out of the body, and that's the way our body cleanses itself of alcohol. However, the intermediary substance acetaldehyde is problematic. There's also a production of what are known as reactive oxygen species, which are damaging free radicals, let's say, the result of all of this process is that you have a few different things that can happen. One of them in the short term is the toxicity which you experience as a hangover usually. And there's also direct cellular toxicity. So these chemicals actually cause damage to cells in the body. Some of this does some acute damage, and other things in other aspects does chronic damage, which we'll get to a bit later. In terms of acute damage, well, you experience a hangover, and depending on how severe the acute damage is, it can go on to what's known as pancreatitis, acute pancreatitis. So if someone ingests a large amount of alcohol, it can actually cause an inflammation of their pancreas, which can be a life-threatening illness. I've certainly seen people who have resulted in having multiple operations following pancreatitis. In the chronic sense, people are at a much higher risk of cardiovascular disease, so heart disease, strokes in the long term, Alzheimer's disease, and these are a result of the pro-inflammatory state that is created by these toxic chemicals that are produced. In addition to that, you've got an increase in the risk of cancer, so breast cancer, oral cancers, throat cancer, esophageal cancer, which is the gullet, liver cancer, and these are quite significantly increased. You might be surprised to know that there's somewhere between a 4 to 13% increase in cancer from having just one glass of wine a day or one glass of alcohol. I want to moderate this comment a little bit by saying that obviously there are no hard and fast facts about everything in medicine, meaning that things are a balance. If a person does, let's say, no exercise whatsoever and they have a glass of alcohol every day, then they may be at this sort of level of risk. If, however, one counterbalances that by doing exercise, it probably modulates that risk somewhat. So you may not be quite at the same level of increased risk than somebody who does no exercise and who eats a poor diet or whatever. So, how much alcohol is too much? Well, there's an article that was published just recently in March of 2022, and this examined the association between alcohol intake and brain structure, using imaging data from about 37,000 generally healthy middle-aged and older adults from the UK Biobank. And this actually showed that there was a negative association between alcohol intake and brain what's called macro and microstructure. So actually structure of the brain that you can see on a large level or with virtually with your eyes, and also on a microscopic level that you can see under a microscope. So for people consuming different amounts of alcohol, even those consuming just 7 to 14 drinks a week, which is what are considered the safe limits, the national guidelines, we are seeing changes in people's brains, which are not good changes, obviously. And you can look up the article yourself in Nature. We'll put the reference at the bottom of the video. So to get back to the question of how much alcohol is too much alcohol, well, we generally accept in society that alcohol is somewhat good and fun, and it's a normal part of our day-to-day life, and therefore it's probably quite safe. Well, for the most part, if you have the occasional drink, it probably is. But what's surprising about this study, apart from the fact that it was done on a large number of people, is that it seems that even quite small amounts of alcohol on a regular basis can cause essentially brain damage. And I think that we underplay this in general. I think that alcohol has become a very much accepted part of our social norm. And, this is not necessarily the case. As time goes on and we examine more evidence, we find evidence of real problems that result from this. As a family doctor, I obviously see a lot of patients, sometimes 30, 40, 50 people a day. And I have to often think of alcohol in the back of my mind when a patient walks in. So I may see someone who is anxious, or I may see someone who's getting headaches, or I might see someone who's depressed. Whatever the reason, I always have to think what else could be going on in this person's life. One of the factors that I always have to think about is, are they drinking too much alcohol? And there is a questionnaire that we're taught in medical school called the CAGE questionnaire, which stands for 4 things. The C stands for cutting down, meaning do you ever feel like cutting down the amount of alcohol you drink? A stands for annoyed. Do you feel annoyed when people might suggest to you that you might be drinking too much? G stands for guilt. Do you feel guilty when you're asked or think about the amount of alcohol that you drink? And E is what's known as the E for eye opener, meaning do you end up drinking alcohol in the morning after you've been drinking the night before? So this is a way of feeling better rather than going on to have a full hangover. We know that alcohol in itself can delay the development of a hangover, let's say. So this is one questionnaire that I can ask people, and if people score even on one of those, and then there's a real concern that they are drinking too much, and this is a subject that needs to be addressed for sure. Do people talk about alcohol easily? Well, if you don't ask, then often not, and partly because alcohol is seen as a very normal part of life, people don't regard it as a problem. I can think of many examples. I can think of someone right off the top of my head right now, somebody who I saw a while back who was on medications for depression, and they'd been on them for a while, doing not so well of late. And one of the questions I started asking them about was alcohol intake. And this person hadn't even considered it because they certainly didn't seem to be addicted to alcohol in any way. But from speaking to them, it was clear that they were actually binge drinking. So they're having large amounts of alcohol 2 or 3 times a week. Now, apart from the fact that alcohol can interact with their antidepressants or anti-anxiety medication and basically nullify the effect, it can also cause adverse effects. And alcohol itself is depressing. It's a depressant drug. So you kind of, on the one hand, you're trying to fix a problem. On the other hand, you're working against that fix simultaneously. Do people get defensive about talking about alcohol? I think if you ask the question very sensitively, most people will open up. Some people do get a bit defensive for sure. And sometimes it's just not the right time to bring up the subject. But I do believe in confronting the subject, because if you don't bring it up, then it's certainly never going to be dealt with. What might a family doctor recommend to someone who we feel they might be drinking too much? Well, the first thing is to qualify and quantify what exactly is going on, to find out why they're drinking so much, to find out when they're drinking. Are they drinking and driving and not realizing they're at risk? What else is going on in their life? Are they using alcohol as a kind of self-medication rather than actually getting psychological help? and also what are the physical risks to them, not just the psychological, but if someone drinks too much, it can cause quite significant bodily damage, including internal bleeding when it gets severe. So these are some of the things that we need to address. And then in terms of recommendations, there might be a recommendation, first of all, to make sure that nutritionally they're well. So we definitely do some blood tests and consider treating any vitamin deficiencies, especially thiamine, vitamin B1, which is a very commonly reduced by chronic alcohol consumption. It's very important to treat it because otherwise you can lead on to quite severe complications. And in addition to that, obviously to try and find a support group, see what counselling is available, and to sometimes to actually refer people to alcohol treatment centres. Obviously, some patients decide even on their own to go to Alcoholics Anonymous, which can also be helpful for the kind of person who decides that they do want to deal with their problem head on. The other thing to mention is obviously that if they are using alcohol as some kind of self-medication for depression, it would be a good idea to get them to see a psychologist, a psychiatrist, and to consider whether they should be on actual medication to help them with their depression as opposed to alcohol. And while medication is not 100% safe, like nothing really is, it's probably a far better option than someone drinking alcohol as a way of dealing with their feelings. Okay, I want to talk about what causes a hangover and how we treat it. So when someone drinks a little bit too much alcohol, the body responds initially with a change in the blood vessels called vasodilatation. So the blood vessels actually widen up, they open up, and then as the hangover proceeds, the body has what's called a rebound vasoconstriction. So the blood vessels close down again, and this causes a headache. The other thing that causes a hangover is dehydration. So just by drinking alcohol, our kidneys start actually releasing more fluid from the body, and we become dehydrated. And there's also content of the actual drink, so nitrites, congeners, and the fact that different alcohols have give different qualities and severities of hangovers. In general, the darker drinks such as dark rum or wine tend to give the worst hangovers, and the lighter drinks such as vodka tends to give less of a hangover. It's thought that drinking orange juice mixed in with alcohol can actually reduce the hangover, and that's partly thought because orange juice contains vitamin C, and vitamin C is an important component of the production of glutathione. And glutathione is an antioxidant that actually helps our bodies to deal with alcohol in the liver. Some things that could help, but I try not to recommend, are taking medications such as non-steroidal anti-inflammatory drugs, such as aspirin or ibuprofen. These can certainly help the feeling of a hangover, but they're not a good idea. If possible, you should avoid them. One medication you should absolutely avoid when drinking and in the period after is paracetamol or acetaminophen. This substance in itself is toxic to the liver, and it's not a good idea to be having it at the same time as alcohol, of course. If you have a hangover, or in order to prevent a hangover, it's important to drink plenty of water with electrolytes and to try and choose the kind of alcohol that causes you to have less of a hangover. Another subject of interest, which is becoming more and more interesting to all of us, is the gut microbiome, the natural gut flora that sits inside us throughout our lives and is literally an organ in itself. Alcohol in itself has an effect on the composition of the microbiome. There's a recent paper talking about this, and I'm going to put it up now on the screen for you to look at. Basically, it talks about how excessive alcohol can actually change the bacterial flora, the different populations, and damage the good bacteria and leave some of the more resistant and more harmful bacteria in place. And that this in itself could cause more oxidative stress, more damage to cells in the body. It can actually open up the intestines, the intestinal wall on a micro level. So they allow the intestinal wall allows bacterial products, antigens, and toxins into the blood, and that this can subsequently increase the chances of alcoholic liver disease and other diseases. So on the same subject, one of the things that is thought to be able to be helpful in this regard is to ingest probiotics. And probiotics, you probably know, are what are known as the healthy or good bacteria. Obviously these things are marketed. In general, however, what's better than taking probiotics is eating prebiotic food. Prebiotic food is basically foods that the bacteria in our guts like. So they prefer these kinds of foods to sustain themselves on and to maintain healthy populations. And here's a little side point, something of interest, which I've heard anecdotally from a lot of patients over the years, is that when they're having a hangover, they've noticed that if they go to the toilet and open their bowels, they get dramatic improvement within seconds, literally, from the effects of the hangover. And if I was to postulate why that is, because I looked up the literature and I couldn't find anything, but I might imagine that there's a significant amount of alcohol and toxins that have been metabolized by our gut bacteria. And the moment one opens one's bowels, they're immediately released and they stop being released into the bloodstream and messages being sent around the body. So that's an interesting tip for you. Okay, so are there actually any positive effects from drinking alcohol? Well, first thing to say, obviously, most people enjoy drinking alcohol, otherwise they wouldn't do it. I think the real problem is about having a balance. It's a far bigger subject to go into whether alcohol should be allowed in society, what damage it does, but I think it is very much about a balance. It reminds me a little bit of a story that I heard a while ago, actually, from a famous comedian, whereby if you want to see unhealthy people, you go into a health food store. If you often go into some of the health food stores, you'll see people who actually look tired and very sort of picky about exactly what they want to eat, and they're looking at ingredients, and they're kind of like introverted and in themselves, and they don't really look that healthy. Their hair's often not particularly it's not particularly bouncy, shall we say. And yes, I know I'm playing to a stereotype here, but this is certainly something I've seen in health food stores. And the same comedian talks about the fact that if you want to see healthy people, you go into a diner and you see people eating burgers and laughing and joking, and they're full of spirit. So the point of this is not to say that health food stores are full of unhealthy people and vice versa, but really to say that health is not just a physical product, but it's actually a state of mind. It's actually about how we balance ourselves in our lives. I think that there's a real importance to being aware of consequences, and we should be making informed decisions about our health. So the idea of talking about this today is to try and give information and also to try and balance that out a little bit. I think part of my role is to educate, and I think that a part of a patient's responsibility is to educate themselves too. So to end up with this, I wanted to say that there is a very real difference between a scientific study and the reality of life. Studies are there to show effects, and they can also be quite focused down on very specific effects. A scientific study about alcohol is usually not going to show any positives, but obviously in real life it does have some positives. It's one of the things that bonds people socially. It does give a degree of enjoyment, and it's important that any consumption of alcohol should be done in a responsible way, in a very, very moderate way, and not too often. So to conclude, I would really love to hear from you. I'd like to know about your experiences. I'd like to know if you learned anything new today and what specifically you learned, and also what other questions you may have. So please feel free to leave comments down below, and I'll do my best to answer some of them. Thanks for being with me today, and I look forward to seeing you again soon.